Fears over valley fever ramping up. Health officials warn our weather conditions could make the risk of getting sick even higher.
So what is valley fever and how can you protect yourself? CBS 13's Hunter Sowards is live at UC Davis getting answers. Hunter.
Yeah, it is that historic rainfall coupled with the dry weather we've seen in recent months that's really driving this surge in cases. And no, it is not just Fresno and Bakersfield that have to worry about this disease. In fact, one man is urging people right here in Sacramento to take the disease seriously.
You need to understand that valley fever cases are increasing, and the increase isn't in Kern County.
A plea from one valley fever survivor.
It's in the surrounding counties in the Central Valley all the way up into Sacramento.
Living with severe complications from the disease.
So I am literally ground zero for valley fever in California. Born and raised here.
At age 38, Rob Purdy woke up with a blinding headache on New Year's Day. It wasn't until Valentine's before doctors finally figured out what was wrong.
It can be devastating in more ways than just physically or medically.
You can get valley fever from breathing in fungus spores from dust and air.
That fungus lives in the soil in certain climates.
Top health officials now warning our wet winter, followed by dry, dusty weather, is the perfect storm of conditions to fuel a surge.
The spores from that fungus can come up into the air and be breathed in by people who are at risk.
Dr. Stuart Cohen with UC Davis Center for Valley Fever says Bakersfield and Fresno used to be considered the most at-risk areas.
Continues to move further north as the climate changes and gets a little bit warmer.
Most cases feel like the flu, causing a cough, chest pains, and a fever. For those with underlying health conditions, it can prove more dangerous.
In a small percentage of patients, it can disseminate throughout the body, and most severe is when it causes meningitis.
Which is exactly what happened to Rob, survivor, now turned Valley Center Foundation patient program coordinator, with a new mission and message for others.
Being your own advocate, asking to be tested. I would much rather ask to be tested and maybe feel a little silly because it turned out to be something else.
Yeah, the big takeaways here is that if you do have symptoms that are lasting 10 days or longer, it is a good idea to request a valley fever test. Also important to note that there has been significant improvements in terms of treatment, but there is still no cure for valley fever. If you are at high risk, have those underlying health conditions like diabetes and others that Dr. Cohen spoke of, you are being told to stay indoors, specifically on windy and dusty days, to try and limit your exposure. Guys?
Yeah, I can definitely understand that. You know, Hunter, what comes to mind when you think of this is masks. I mean, we all got used to wearing them, but would a mask help for valley fever?
You know, it's interesting. I asked that of the doctor, and he said tight-fitted N95 medical grade protection could offer some relief again from those symptoms or from catching the fungal matter here. But again, it is going to be something that you have to keep in mind, even if you're driving. He said to Southern California, Dr. Cohen said he keeps his windows rolled up so that no dust gets inside the car. Just something to think of, though, that could offer some protection.